Good afternoon. Welcome to our webinar, Breast Implants, Are They Worth the Risk? Part 2. This is a continuation of a topic that was started by Dr. Lu-Jean Feng several weeks ago. We'll continue the conversation. Hi, I'm Linda Haas, and the Director of Operations and CEO of the Lu-Jean Feng Clinic in Cleveland, Ohio. I've worked with Dr. Feng for the past 18 years, and together we've experienced and helped a lot of women who have had problems with both silicone and saline breast implants. There's no one better to share her experience and expertise in this area than Dr. Lu-Jean Feng, a graduate of Yale and Yale Medical School, a very brilliant surgeon. So let's get started. Dr. Feng, I'll turn the seminar over to you.
Good afternoon. Hello, everybody. I really cherish the opportunity to speak to all of you concerning this very important subject. So let me hear your first question, Linda.
We have many questions that have come in from all over the world, including Australia, Canada, and the United States. We have a number of participants today. I hope you find this very informative and educational. Dr. Feng, the first subject matter that we'll discuss this afternoon involves detoxification and mold. This seems to be a very important topic and something that is on the minds of many women who have breast implants because of the controversy involved. Why does one plastic surgeon have a high rate of patients who she sees who have mold in or on their implants, and you rarely see this in your practice?
That's a very good question. I can't comment on one plastic surgeon's experience, but in general, there are very few plastic surgeons that see mold. And certainly in my own experience of thousands of implants, explantations since the early 90s, I haven't seen any mold except for one case in the late 1990s. So I'm very familiar with the clinical picture of mold infection. But for the thousands of other cases, I don't see that.
Thank you. Another question that was offered, how do you ensure patients that they don't have mold in or on their implants?
Well, first of all, we are very careful in preserving the implant during removal. And after the removal, through an en bloc procedure where you have the implant and capsule coming out at the same time, I have my nurse photograph it right on the operating room table, and then we cut open the capsule and really carefully look at the implant to see how clear the contents are and whether there are any black spots. Any black spots on the implant, whether it's in the actual valve itself, has been analyzed. And these were mostly actually components of blood, believe it or not. Then it's photographed and sent to an outside pathology firm to have it examined, especially the capsule. And so we're very familiar, certainly the pathologists are very familiar with the histomorphological picture of mold. And so far, they have not seen it. I certainly have not seen this since that one case in the late 1990s.
Thank you. Another question regarding the same topic. Do you test the implants specifically for mold and fungus? And if not, why not?
We absolutely test specifically for any microorganism, whether it be fungus, bacteria, or cancer. This is where the pathology is so important, because your pathology examines your response to the implant. So if there is mold present, there will be telltale signs of that, meaning there will be granulomatous formation, epithelioid cells, eosinophils, but these are highly unusual. We see mostly lymphocytes, plasmacytes. These are all immune response to a foreign body.
Thank you. Another question. Do you think it's necessary to send the implants and capsules to Dr. Blay in Ottawa, Canada for further analysis.
The capsules in my practice are sent to pathologists who is very experienced at reading capsular pathology. Now, Dr. Blay is a biomaterials PhD engineer. He has a lot of experience and knowledge regarding implants. If you need more information on the implants, then I would send it to him. But since most people are more concerned about their own response, their own reaction, and what is happening to their body, I think the capsular pathology will be most important.